All right, welcome back. As a reminder, my name is Eunice Mathis. I'm the nurse educator with Florida Training Academy. Today we are completing the nurse aid practice test. These are sample questions for those who want to become CNAs or certified nursing assistants in the state of Florida. We left off on question number 15, and now we're picking back up with question 16. All right, so if you have any questions regarding the written portion of the test, please review the first portion of the video. Right. Question number 16. When a person is admitted to the nursing home, the nurse aide should expect the resident will A, have problems related to incontinence, B, require a lot of assistance with personal care, C, experience a sense of loss related to the life change, or D, adjust quickly or more quickly if admitted directly from the hospital. All right, so not everyone who goes into a nursing home has personal care issues or concerns. Some may need medication management. Some may go into the nursing home, just to combat loneliness or just to, be able to socialize. So you cannot expect them to, automatically have a problem with incontinence. If a person was urinating or wetting themselves, the way that you could, help them is by taking them to the bathroom more frequently. So A is not the correct answer. B, as I just told you, not everybody who goes to the nursing home needs personal care. Some people can give their baths, but if their diabetes has caused their vision to decrease to the point where they can't give themselves their insulin, well, then that person would be institutionalized or put in a nursing home for medication management. So the answer is also not B. Think of this person who was able to live independently, do most of everything on their own, except for administer their insulin 4 times a day. How are they going to feel when we put them in a facility that now tells them when they can eat, when they can bathe, what they can watch, what time bedtime is, and that they cannot drive? So the answer is going to be C. They're going to experience a sense of loss related to life change. And this is really important because sometimes when those residents are admitted to the nursing home, they may be a little more difficult to deal with, but just think about their sense of loss and that they could be depressed, and just love them through the transition. "17. A resident gets dressed and comes out of the room wearing shoes that are from 2 different pairs. The nurse aide should A, tease the resident by complimenting the resident's sense of style. B, ask if the resident realizes that the shoes do not match. C, remind the resident that the nurse aide can dress the resident. D, ask the resident if they have lost some of their shoes or his shoes. The correct answer is going to be B. If you think about the characteristics of aging or what happens as we age, a resident may have put on shoes that don't match simply because their vision has decreased to the point where a brown shoe and a black shoe, they look like they're the matching shoes. Also, because of limited range of motion or limited reach, they may have just simply picked out 2 shoes that they could reach. So as a CNA, I want you to be thinking of ways that you can keep your patients as independent as possible for as long as possible. So maybe, the person who works on the evening shift could help the resident assemble their clothing, their shoes, or maybe you can ask the family members to buy an over-the-door shoe rack, and that will hopefully help the person maintain their independence. The resident does not need to be dressed for simply putting on shoes that don't match. You need to be mindful that, decreased vision acuity, decreased hearing, the skin is going to be thinner, the muscles are also going to get weaker, and just remember that the heart, the bladder, those are also muscles. So if you don't move fast enough when a resident calls you, if they have to go to the restroom, they may experience an incontinence episode. Next question, 18. A resident's wife recently died. The resident is now staying in his room all the time and eating very little. The best response by the nurse aide is to A, remind the resident to be thankful for the years he shared with his wife. B, tell the resident that he needs to get out of his room at least once a day. C, understand the resident is grieving and give him chances to talk. D, avoid mentioning his wife when caring for him. The answer is going to be C. Active communication, especially when you're a caregiver taking care of a resident, active communication is giving them opportunities to talk and listening to them. So it's not always about what we want them to do. You want to engage your residents, hear him out. I'm sure he misses his wife. So telling him to go outside is not going to allow him to communicate. Actually listen to his concerns and listen to him talk about his wife and chime in as appropriate. 19. When a resident refuses a bed bath, the nurse aide should A, offer the resident a bribe, B, wait a while and then ask the resident again, C, remind the resident that people who smell don't have friends, D, tell the resident that nursing home policy requires daily bathing. And actually D is incorrect. It does not require daily bathing. The residents they have their rights and they have the right to refuse. So if a resident does refuse a bed bath, you definitely want to do B, but I'm going to ask that you add more to it. You're going to wait a while and then ask again, but while you're waiting, I need you to go ahead and notify your nurse. Notify your nurse that the patient refused a bed bath, and you're going to document it in a computer. And when you document it, you're also going to document that you notified your nurse. So now let's say you offer the resident a bath twice, and you've made the nurse aware twice, and you've documented it twice. Now when the night shift comes on or the family visits in the evening, no one can be upset at you because you followed the chain of command. You did try to give the bed bath, but however, the resident refused, and for whatever reasons, your nurse did not attempt. But at least you covered yourself. 20. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to A, show the resident that the nurse aide is in control. B, call for help to make sure there are witnesses. C, explain that if the resident cannot be calmed, a restraint may be applied. D, step back to protect self from harm while speaking in a calm manner. So as a CNA, as a healthcare professional, you want to, understand de-escalation, measures. Don't tell anyone to calm down, because usually their response is, I am calm, and then they act out even more so. If you call more witnesses, those witnesses, if they're not, it says here the resident is combative, I wouldn't necessarily call witnesses. I will call for help after I step back to protect myself from harm. Please protect yourself. We don't want you getting injured. And if you're just calling to make sure there are witnesses, that means that you've never stepped back. You don't want to engage. You don't want to have to, go one-on-one with a resident or a patient. Step back, call for help. And then, of course, as a CNA, you do have resources such as the nurse. Let the nurse help you decide what the next best step should be, since the patient is combative at this point. 21, during lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to A, remain calm and ask what is upsetting the resident. B, begin removing all of the other residents from the dining room. C, scold the resident and ask the resident to leave the dining room immediately. D, remove the resident's plate, fork, knife, and cup so there is nothing else to throw. And from teaching this course for many years, I've heard many students choose B, C, and D. The correct answer is A. All right, so I remember this one time there was a patient who's on a kosher diet, who received a breakfast tray that had bacon. And then I think for lunch, he also received another pork product. I was upset as his residence nurse because it made no sense for him to have a kosher diet. He could not have the pork products, for that to be on his trays twice, which means that for 2 meals, this particular patient ate late. So I could understand if that person, would have became upset and acted out. Fortunately, they did not. But if I would have, overreacted, then I could have made the situation worse. So I want you to remain calm, ask what is upsetting the resident, and then just think about that patient I told you who has a kosher diet for religious reasons, but yet they're still receiving pork products. If you get close enough to remove the plate, fork, knife, you got close enough to get injured. Remember, they were throwing items. So again, remain calm, ask what is upsetting the resident, and then maybe we can de-escalate. 22, which of the following questions asked to the resident is most likely to encourage conversation? A, are you feeling tired today? B, do you want to wear this outfit? C, what are your favorite foods? D, is the water warm enough? Whenever you're trying to promote conversation, you want to ask open-ended questions. Open-ended questions cannot be answered yes or no. So the only question here that cannot be answered yes or no is C, what are your favorite foods? That will require a resident to say something other than yes, period, no, period. Hopefully they're going to be more likely to conversate with you. 23, when trying to communicate with a resident who speaks a different language than the nurse aide should A, use pictures and gestures, B, face the resident and speak softly, C, repeat words often if the resident does not understand, D, assuming the resident nods his or her head and that the message is understood. And the answer is going to be A. You're going to use pictures and gestures. Most of your facilities will have a laminated piece of paper that has, the smiley or crying faces. It may have numbers, alphabets. It could also even have pictures of a toilet, a cup of water, etc. So that way, if you're speaking to a person who has a language barrier, a cup in another country still looks like a cup in the United States. So that would be their way of indicating they were thirsty, or a toilet would look the same. So that would be a way to communicate with someone. Even when I'm teaching students in the classroom, I go ahead and mention those patients who have fresh tracheostomies, who don't have vocal abilities yet. It takes a while before they can get that synthesizer that will allow them to speak, or before we can actually cap their trach so you can hear their voice. So please don't frustrate your trach patients by always trying to read lips. There's an easier way to communicate: paper and pen, or maybe they have some type of smart device like a tablet or a cell phone that they can actually, electronically write on. Worst case scenario, ask one of the family members if they can go to the, one of the inexpensive stores such as the Dollar Tree to buy a small dry erase board. And that way you can communicate with your trach patient without, sometimes we try to read lips, we don't understand them, so we end up frustrating the patient. Be careful with 23D, assuming the resident nods his or her head that the message is understood. Some of the older Asian cultures, some of the older Asians, to say no and or to make eye contact would be a sign of disrespect. So they'll say yes to everything. So what I do is when I'm teaching someone, I do return demonstration. So if I'm showing you, the call bell, and I'm showing you where the nurse button is, I'm going to actually have you put your finger on it, press the button. I'm going to point to me and say, hey, I'm the nurse. This is how you call me. But now I have to do an extra step, because whenever they press that button, usually the secretary comes overhead and asks, how can I help you? Well, if the person has a language barrier, they're not going to communicate with the secretary. So when the secretary comes over, comes over the speaker, that's when I will let him or her know that, hey, this particular resident or patient has a language barrier. Whenever they press the red button, they won't be able to, explain to you in our language what they need. So I need for you to go ahead and send the CNA or the nurse, into the room. So that would be a way that you can keep your patient safe, even if they have a language barrier. 24, while walking down the hall, nurse aide looks into a resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to A, contact the state agency that inspects the nursing facility, B, enter the room immediately to provide for the resident's safety, C, wait to confront the nurse when he or she leaves the resident's room, or D, check the resident for any signs of injury after the nurse aide leaves the room. Where, of course, we know the safest thing for our resident is to do B. You're going to enter the room immediately to provide for the resident's safety. Just be very careful. Don't hit the other nurse aide. Your job is to protect the resident, and I will also be screaming for help while I am trying to protect the resident, because I need other people to, come and try to, at least get the other nurse aide off of the resident. We don't want you, getting into a fight before the test. B is the correct answer. If you did A, that's going to take too long. They may not come out to investigate for a whole 2 or 3 weeks. So you are a mandatory reporter. So if you see something, you need to go ahead and say something. And by all means, if you can prevent an attack from worsening, that is your duty to do so. 25, before touching a resident who is crying to offer comfort, the nurse aide should consider A, the resident's recent vital signs, B, the resident's cultural background, C, whether the resident has been recently sad, or D, whether the resident has family that visits routinely. And the correct answer for this is going to be B. So sometimes you can tell the women who are from the Middle Eastern cultures or religions, like let's say the Muslim religion, because they will have the head garments on. So if a male goes up who's outside of her religion, outside of her family, and he touches her, even if she is crying, that can be deemed as a sign of disrespect. So what do you do if you see someone who's crying? You're going to at least stay a few feet away. I'm not big on approaching people, getting all up close, but I'm going to, try to make eye contact, scoot down just a little bit so I'm not hovering over them. And I'm going to ask them if there's anything they need, if they need a chair, if they need some tissues, if they're, if they're already seated, who do you need for me to call? This may not be one of your residents or patients. This could be one of the visitors, but be very careful before you touch anyone. You always want to get their permission first. And again, you can offer comfort to someone who's crying without touching them. 26, when a resident is expressing anger, the nurse aide should A, correct the resident's misperceptions. B, ask the resident to speak in a kinder tone. C, listen closely to the resident's concerns. And then D, remind the resident that everyone gets angry. Where we have already discussed that whenever you're trying to communicate with someone, active communication means that you have to listen. So the answer to 26 is going to be C. 27, while giving a back rub, the nurse aide should A, apply lotion to the back directly from the bottle. B, keep the resident covered as much as possible. C, leave extra lotion on the skin when completing the procedure. D, expect the resident to lie on his or her stomach. The answer is going to be B. You only want to uncover what is absolutely necessary. For example, if you're bathing the legs and the feet, you should not have the rest of the body uncovered. You would just expose the lower extremities. It would not be A, apply lotion directly from the bottle, because we usually warm the lotion, excuse me, whether it's in our hands or our gloved hands, before we apply it to a resident's skin. We do not want to do C. Do not leave extra lotion. Anytime you leave the skin wet, even if it's with moisturizer, that's going to be an area where the skin could break down and possibly cause a skin tear or a rash. And then D, most of our older residents prior to COVID, we did not have them lying in a prone position, which is on their stomach. And especially think of somebody who may have a gastric tube or non-COVID related respiratory problems such as pneumonia. If they lie on their stomach, it's going to be harder for them to breathe. So when you're giving someone a back rub, you can do so by just simply having them on their side. And they don't even have to be flat. You can have the bed at like a 30-degree angle. And when they're turned to their side, you can provide the back rub. 28, a nurse aide finds a resident licking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to A, help the resident back into his room and into bed. B, ask the resident about his job and if he's hungry. C, tell him that residents are not allowed in the nurse's station. D, remind him that he is retired from his job and in a nursing home. What I want you to think of is that, even your confused patients have a moment of clarity. So if it's 5 a.m. and this person who is confused about needing to go to work is in the pantry, is in the refrigerator trying to get food, he may not be confused about being hungry. So the best response, the only one that addresses this resident's hunger, is B. Ask the resident about his job and if he's hungry. And so sometimes your patients who have dementia or Alzheimer's, they will say things like, oh, my catheter hurts, or oh, my arm hurts. And if you don't pay attention to them, like literally their catheter could be leaking urine, or there's going to be blood in the urine, meaning that it's irritated. Or when you pull back the covers to check their arm, since they've been saying it's hurting, you'll see that the IV fluids have infiltrated, and the arm is swollen. So even with your confused patients, and they may have that moment of clarity. Most of your facilities feed your residents dinner around 5 p.m. And this passage doesn't tell us anything about how well this person ate breakfast or lunch, or even if they had a bedtime snack. All we know is that there is somebody in the refrigerator at 5 a.m. And unless their diet says otherwise, I recommend you feed them. If you do any of the other, selections there, if you ask him about his job, put him back in the bed, he's going to get back up and go into the pantry. 29. Which of the following is true about caring for a resident who wears hearing aids? A, apply hairspray after the hearing aid is in place. B, remove the hearing aid before showering. C, clean the ear mold and battery case with water daily, dry completely. D, replace batteries weekly. Hearing aids are expensive. So the way I want you to think about hearing aids, dentures, etc., is that if you didn't go to school to learn how to repair them, you don't repair them. So the answer to this is we want to keep it safe. We don't want this electronic device getting wet. We're going to do B. We're going to remove it before they shower. And normally, like similar to the denture cups, you would place the hearing aid in a cup, put your patient's name on it, and literally mark hearing aid. So if they have two hearing aids, you may have two different cups, one for the left, one for the right. But you definitely want to keep track of those devices because they're extremely expensive. And if you or another tech or personnel period loses that hearing aid, the facility may be responsible for replacing it. 30. Patients with Parkinson's disease often require assistance with walking because they, A, become confused and forget how to take steps without help. B, have poor attention skills and do not notice safety problems. C, have visual problems that require special glasses. D, have a shuffling walk and tremors. And the misconception is that somebody who has Parkinson's disease, who has the tremors, and they also have like a shuffling and walk kind of like a mummy, is that they also have dementia. That is not necessarily the case. So someone can have Parkinson's without any confusion. It may just take them a while to get their words out. So you don't want to ask them multiple questions in succession, and you don't want to ask them questions that involve a lot of detail. So the correct answer for 30 is D as in dog. Someone with Parkinson's may have a shuffling walk and tremors. All right. And so that is the end of section number 2. We'll complete section number 3 later. Again, my name is Eunice Mathis. I am the nurse educator at Florida Training Academy. Our website is www.fl-as-in-Florida-training.com. We provide CNA, CPR, and also CPR instructor level classes. We also have a CNA instructor level and phlebotomy instructor level class. So if I can be of assistance to you, I would love to be your nurse educator. You have a great day, and we'll talk soon. Bye-bye.